Haemobilia. This is an important MCQ topic which has some straightforward one or two question. So what is haemobilia? It is bleeding into biliary tree due to abnormal communication between blood vessel and bile duct. So why does it occur? The causes can be trauma. It can occur due to gallstone. It can occur due to parasitic infection. It can occur due to some vascular pathologies like hemangioma, aneurysm. Right. Now the clinical features over here could be a biliary colic. It may present with an obstructive jaundice, or it may present with melena or occult blood in stool. Now, these three features form a triad which is called a Quincke's triad, or the Sandblom triad. Now, usually occult blood in stool is most common finding, present in around 90%, obstructive jaundice being present in around 60%, and biliary colic being present in around 70%. The diagnosis, the first step that we do is endoscopy, right, to visualize the bleeding. However, if you guys are asked what is the investigation of choice, it is arterial angiography. Now, what would be the treatment? If it is in minor haemobilia, we can have conservative treatment. However, if it is major, we need to go for trans arterial embolization, which if fails, we need to go for surgery where ligation of bleeding vessel needs to be done, or the excision of aneurysm as needed needs to be done. So, haemobilia, it is bleeding into the biliary tree due to the abnormal communication between the blood vessel and the bile duct. Cause is trauma, a triad known as Quincke's triad or the Sandblom's triad. It consists of biliary colic, obstructive jaundice, and melena or occult blood in stool. The first step in diagnosis is endoscopy. However, the investigation of choice is arterial angiography. Treatment, if minor, conservative. For major, we'll go for a transarterial embolization. If fails, then we go for surgery.